Hey guys! Today I wanted to share with you the duties and responsibilities of a room nurse since I'm currently kind of training as one, but I've been working as a room nurse for the last 2 weeks. So yeah, that's one of my goals for this year is to start working as a room nurse at my job, and I've already accomplished that, which I'm excited about. So these are things just to expect as the room nurse at an OBGYN office, obviously because this is the only nursing experience I have so far. The first thing that you're going to do is set up the doctor's office. When I get to my job, I grab the lab coat with my doctor's name on it. I dial into the extension that they're connected to. I get their stethoscope, the Doppler, so that they can listen to the OB patient's fetal heart rate, and a tape measure. And I also put the business cards out in case, they're doing a consult with somebody and they want to take a card with them. I also call patients to discuss their Pap results or any kind of swab that we do, like a new swab or herpes simplex virus swab, gonorrhea, chlamydia swab, anything like that. As soon as their results come back, I give them a call. If they have chlamydia, we usually send in azithromycin. If they have gonorrhea, they need to come in for a Rocephin injection. So I schedule that as well, and then they come back in 3 to 4 weeks for TOC, which is test of cure. We do another swab to make sure it's gone. If it's not, we give you more antibiotics. Another thing that room nurses are responsible for is sending prescriptions to the pharmacy. So if you have people coming in for an annual that are on birth control, you're responsible for sending in another year's supply of their birth control pills, or if they need their Depo-Provera shot filled, you send that prescription to the pharmacy so that they can come in for their injections. We also send Estrace cream prescriptions to the pharmacy for people who are menopausal and just have vaginal atrophy. Another thing that we're responsible for filling out, and it's not one of my favorite parts of room nursing at all, is the FMLA paperwork or disability paperwork for people who are taking leave due to having a baby or they're having a major surgery and they need time off from work to recuperate. This paperwork is very stressful, especially if there's certain accommodations that need to be made for that patient's needs, because we have to send it to the business that they work at, make sure it goes through. If it doesn't, they send it back. We got to do all these other prior authorizations, and it's a pain sometimes. I understand they need it, but it's just FMLA paperwork, you're killing me. The other thing we do is referrals, and we send the referrals for mammograms if they need to go to a GI specialist, for colonoscopies. We also do weight loss referrals, and we also send, if they're high-risk OB patients or advanced maternal age patients, we send them to other OB offices to make sure that they're getting care there as well, because if they're high risk at our practice, we typically don't tend to see them because we just don't see high-risk patients. That's the whole point of referring them to the other facility. They're more skilled and adequately prepared for the high-risk patients or the advanced maternal age patients. The other thing we do is set up for procedures. We set up for colposcopies, we set up for IUD removals and insertions, and we also set up for punch biopsies if someone has a skin growth on their labia or, in their vagina, and we do a punch biopsy. We have to set up for that. We also assist with the Pap smears and the swabs for STD testing. We also assist with the pessary exam or cleaning. Usually every so often, couple of months, people that have a pessary will come in. The doctor will take the pessary out. The nurse is responsible for rinsing it with soap and warm water, and then we put it back in. And we also assist with the pelvic exams, if someone is 35 weeks or above and they're coming in to see if their cervix is dilated. Basically, you just step in the room, hand the doctor, the glove, and give them some lube, and they go up in there and they'll tell you, yeah, you're dilated, or no, you're not even at 1. And we also schedule patients for any type of procedure they may need. If they need to come in for an IUD insertion, come in for a lab to get their beta drawn or a TSH level drawn, we can schedule them for colposcopies. We schedule them after you call them with results, like if they have ascus, which is the atypical squamous cells of undetermined significance on a pap smear, and they need a colpo, we will call them and be like, hey, you need to come in for a colposcopy. When's a good day for you? Put them in the schedule, and we get it done and over with. And the next thing is room nurses kind of oversee the intake nurse, so they make sure that the intake nurse is on point. Like, did you give this patient that is 26 to 28 weeks their glucola? Had they signed their shoulder dystocia and vaginal delivery consent? And they just make sure that the flow is just going, and there's always a room open for other patients, and they're clean once that patient leaves the room. And the other thing that a room nurse will do, whenever the doctor says, hey, I need this, or help me with this, can you call this patient, can you do this, do it. Make the doctor happy. You don't ever want to put stuff off when a doctor wants something done, because they're your boss. You're working for them for a reason. When a doctor gets upset, you're kind of in trouble. And the other thing that a room nurse is going to do, and the intake nurse can do it too, since I've been kind of cross-training as intake and room, I just do it now. It's kind of a habit. But you will take all of the pap smears and the swabs or any kind of wet mounts or anything that you do to the lab to be sent off for their pathology, and to see, you know, if their pap smear comes back normal. They're going to test for HPV. All the results will come back once you drop that off at the lab, because the lab is responsible for sending it to wherever it needs to be tested at. And the other thing that room nurses will do is keep a steady line of communication between the intake nurse, the doctor, and themselves. So as long as we're all communicating and we know what's going on, like, oh, you're getting ready to go in this room, that patient has gestational diabetes, here's her diary of her blood glucose levels all throughout the week. That patient's on an NST due to IUGR, which is intrauterine growth restriction, or this patient has been running hypertensively for the last 5 visits. I looked in her chart. You know, you just always want to be aware and alert of what's going on with that patient. A lot of our patients rotate providers, so if it's a patient I know that we've never seen before, I will look in her chart before they come in and just see, like, oh, she has gestational hypertension or gestational diabetes mellitus. She has history of tachycardia, you know, all kinds of stuff. So you just want to know all about that patient as much as you can before they come in. If they're a regular patient of yours that always sees the doctor or nurse practitioner that you're working for, you're kind of going to know them and, you know, how they act and how they feel. If you feel like something's off or if they're having issues, you're the nurse, it's your job to be nosy, and you just want to really ask them all kinds of questions, like, oh, you're feeling bad today? When did this start? Have you been vomiting? Have you been puking? If a pregnant patient comes in and, you know, they're talking about not really feeling themselves and they've been cramping, I always ask, well, you've been cramping, is there any blood? Is there any type of abnormal discharge? Because some discharge is normal during pregnancy. Any Braxton Hicks. And I always ask if they're having contractions, if they're, you know, 35 and above weeks, because they got like 5 weeks to go. And you can just kind of rule things out if you ask certain questions. So I hope this helps you guys kind of have an insight of what room nursing in an OBGYN office is like. We probably do a little bit more than that, but those are things that I just jotted down throughout the week as I was doing them. And yeah, I hope this helps you, and I hope you get a better view of what we do. If you have any video suggestions or comments, as always, please feel free to leave them.